The subcommittee will reconvene, and I see our second panel is already seated. Let me introduce each of you. On my left is Mr. Michael Ambrosio, who is from the Food Marketing, or representing the Food Marketing Institute, and he is the Vice President for Quality Assurance Division at Wakefern Food Corporation. Next, we have Ms. Pamela G. Bailey, who is President and Chief Executive Officer of the Grocery Manufacturers Association. And then we have Ms. Caroline Smith DeWaal, who is the Safe Food Coalition Food Safety Director of the Center for Science in the Public Interest. Dr. Tim F. Jones, who is a state epidemiologist from the Tennessee Department of Health. And last is Mr. Thomas E. Stenzel, who is President and CEO of United Fresh Produce Association. Welcome. You know, it's 5 minutes, and obviously your statements become part of the record if you want to include material more than the 5 minutes. And we all heard before, I know some of you were wondering if you can meet the deadline, but since we do intend to go to markup next week, I agreed with what Mr. Who brought it up? Mr. Shimkus said about we'll give you any additional written questions by the end of business tomorrow, and we'd like them back by Monday at the end of business. So we'll start with Mike Ambrosio. Thank you for being here again.
Thank you. Chairman Pallone, Ranking Member Deal, and members of the Health Subcommittee, I am honored to appear before you today on behalf of the Food Marketing Institute to present our views and suggestions on the Food Safety Enhancement Act discussion draft. FMI and its member companies share the common goal of enacting legislation this year that will genuinely improve the safety of the food supply. Steps that actually prevent the presence of adulterants in the food supply are the only true way to improve the safety of our food. I am Mike Ambrosio, Vice President of Quality Assurance for Wakefern Food Corporation. I have been in charge of food safety programs at Wakefern for 30 years. Founded in 1946, Wakefern has grown from a small, struggling cooperative into the nation's largest retailer-owned non-farm cooperative in the United States. We are headquartered in Keesby, New Jersey. Wakefern, along with its ShopRite stores, employs over 47,000 individuals in New Jersey, New York, Pennsylvania, Delaware, Connecticut, Massachusetts, Rhode Island, and Maryland. Today, I am also representing FMI, a national trade association that has 1,500 member companies made up of food retailers and wholesalers in the United States and around the world. FMI members operate approximately 26,000 retail food stores with combined annual sales of roughly $400 billion, representing 3/4 of all retail food store sales in the United States. FMI's retail membership is composed of national and regional chains, as well as independent grocery stores. This morning, I will present several of FMI's recommendations for revising the bill, but I ask that my entire statement be included in the record. In April 2008, I testified before this subcommittee on legislation that would have modernized and overhauled the food safety systems at the Food and Drug Administration. Since that time, high-profile food safety outbreaks and recalls involving tomatoes, jalapenos, peanuts, and pistachios have not only made headlines, but regrettably have caused illness and in some cases even death. Many of the themes and ideas that I share today will be similar to those that I shared in 2008, but there are differences that reflect lessons learned and new weaknesses in the existing food safety system identified from these latest recalls. As the purchasing agent for the consumer and the final link in the supply chain, our industry understands that it is vital to ensure that the FDA has the necessary authority, credibility, and resources to meet the challenges of today's global marketplace. Consumer confidence remains an essential factor in this debate. Food safety issues can be extremely complex, and consumers vary greatly in their knowledge of the science and other issues affecting the safety of our food supply. However, as food safety issues draw national headlines, consumer awareness has a concern about the safety of commercially prepared food and products purchased at the supermarket heightens. Mr. Chairman, I applaud you, Mr. Dingle, Chairman Waxman, and all members of the committee for your efforts to address changes that are needed to improve our food safety system. We support many of the proposals in the draft by emphasizing the need to have preventative measures be the foundation on which the food safety system should be built. The draft also recognized that we need to focus on the majority of resources on facilities and products that pose the greatest risk of contamination that could result in foodborne illness or injury. We must continue to be sure that any changes meet certain criteria, be supported by science, have measurable benefits, be affordable, be realistic, and be implemented without unintended consequences. First, we applaud you for not only designating an entire section of the bill solely to prevention, but also putting this first and the most extensive section of the bill. From our perspective, this is the appropriate emphasis. In addition, I would like to specifically comment on certain sections of the draft. FMI recognized that a strong public-private partnership is needed to help ensure safety of the food supply. Although every penny counts in these tough economic times, there is nothing more important than improving and ensuring the safety of our food supply. We are willing to support a fair registration or user fee, provided that it is utilized by the FDA in a transparent and accountable manner to improve the safety of our food supply through means such as conducting research and consumer education programs. We look forward to working with the committee to address our concerns about how the FDA may utilize any fees collected. We support the requirement that every registered food facility conduct a risk assessment and implement and maintain a validated food safety plan and identify potential resources of contamination and appropriate food safety controls and document those controls that will prevent, eliminate, and reduce potential hazards. Adherence to food safety plans goes a long way towards developing a culture within a company that is critical to ensuring food safety. Mr. Chairman, thank you for the opportunity to testify. We appreciate the work that has gone into the development of the Food Safety Enhancement Act discussion draft with the goal of improving food safety and the food supply and helping to restore consumer confidence in the food safety system. I look forward to your questions and remain available to the subcommittee. Thank you.
Thank you. Ms. Bailey?
Thank you, Mr. Chairman. Good afternoon.
I don't know if that's on the mic. Oh, you don't have a mic.
I have a mic. Thank you. Yeah. I'm Pam Bailey, and I'm President and CEO of the Grocery Manufacturers Association, which represents more than 300 food, beverage, and consumer products companies. Americans enjoy one of the safest food supplies in the world, but we recognize that steps can and must be taken to make our food supplies even safer. We applaud Chairman Waxman, Chairman Emeritus Dingell, Chairman Stupak, and Chairman Pallone for developing the discussion draft of the Food Safety Enhancement Act of 2009. Product safety is the foundation of consumer trust. We look forward to working with the committee to quickly enact food safety reforms that will restore consumer confidence and will continually improve the safety of our food supply. Although the food industry is ultimately responsible for the safety of our products, strong government oversight is a critical part of our food safety system. That is why GMA supports much in the discussion draft, including your proposal to set safety standards for fruit and vegetables, your proposals to improve the safety of imported food and food ingredients, and your proposals to give FDA strong enforcement powers to deal with bad actors, including mandatory recall authority. In particular, we strongly support proposals to require all food manufacturers to conduct a hazard analysis to identify potential sources of contamination, identify appropriate preventive controls, and to document those preventive controls in a food safety plan. We believe that food safety plans are the cornerstone of prevention in that they will help ensure that safety is built in from the very beginning. We have proposed certain modifications to some of these provisions to your staff, and we look forward to working with you. In particular, we look forward to working with you to address your concerns about traceability. We recognize that the discussion draft instructs FDA to assess the costs, benefits, and feasibility of traceability technologies and gives FDA the power to exempt certain foods. Furthermore, we recognize that the discussion draft instructs FDA to conduct pilot projects and public meetings. However, we believe that these studies, meetings, and pilot projects should be completed before FDA decides whether and how to assign the food industry the responsibility for tracking a food product and which coding and identification systems may be best suited to this task. As you anticipate in the draft, the cost and feasibility of requiring every manufacturer to maintain the full pedigree of every ingredient in every food may outweigh the public health benefits. To address concerns raised during the peanut product recall, we urge you to consider whether intermediate distributors and brokers should include on the labeling of their bulk ingredients the identity of the ingredient supplier. In general, we support proposals to give FDA stronger enforcement powers, including the power to order a recall. We believe that certain enforcement provisions of the discussion draft, such as mandatory recall and suspension of registration, should only be exercised by senior agency officials when there is a risk of serious adverse health consequences and should ensure that companies are afforded certain due process protections, such as an administrative hearing. As we saw during the recent recalls of tomatoes and jalapeno peppers, recalls can have a devastating financial impact, and they need to reflect the best science and wisest agency judgment. Finally, we strongly support efforts to provide FDA with additional resources. GMA helped create the Alliance for a Stronger FDA, and we have worked with other consumer and industry groups to increase FDA spending. If Congress enacts the FY 2010 request of the FDA and the Obama administration, we will have seen food safety spending at FDA increase by nearly 80% since FY 2006. More funding is needed. We look forward to working with the committee to identify an appropriate role for industry. Our industry is significantly increasing our own investments in food safety, and we are prepared to make additional investments to continually improve the safety of our food supply and to comply with many of the new mandates that are envisioned in the discussion draft. We are not opposed to all fees, and I am confident that the committee can reach a bipartisan consensus on the agency's resource needs and an appropriate role for industry. Let me close by saying again that the food and beverage industry is committed to working with you to quickly enact food safety legislation, which makes the prevention of contamination the foundation of our food safety system. Thank you.
Thank you. Ms. DeWaal.
Thank you very much. Thank you for your leadership, Chairman Pallone, and also the leadership from many other members of this subcommittee and committee. And also thank you to you, Ranking Member Deal, for the many hearings that we've sat through. We've listened to the witnesses. It's just this work has been going on before this committee for a long time, and I think hopefully we are nearing an end. My name is Caroline Smith DeWaal, Director of Food Safety for the Center for Science in the Public Interest, but today I am representing 10 consumer, public health, and victims advocacy organizations that are members of the Safe Food Coalition. Let me begin by saying that we believe this is a strong bill that will improve food safety. It requires food companies to build into their processes the conduct of regular hazard analysis, and they have to institute preventive controls to prevent problems from occurring. It provides a modern framework for food safety oversight to replace the antiquated food safety laws that have hamstrung the Food and Drug Administration. It gives FDA essential new authority to carry out the mission of preventing illnesses and outbreaks, and to inspect food plants much more frequently. And it addresses the funding issues urgently needed to institute the program improvements, doing this with a modest registration fee. The heart of any effective reform effort lies in prevention, which is in the bill's hazard analysis and preventive controls section. The bill provides FDA with new tools like written plans and access to processing records that will allow government inspectors to review the conditions in plants over time, not just when inspectors are in the facility. We recommend additional strengthening of the bill by requiring companies or labs to report pathogens on final product samples to FDA whenever they are encountered in a facility. This would give FDA an early warning of problems and might prevent another tragedy like the outbreak linked to the Peanut Corporation of America. It is a common adage that you cannot detect what you don't inspect. Random and frequent inspection by public officials is a necessary component of an effective food safety system. This legislation divides food companies into 3 categories based on risks and directs FDA to inspect the facilities every 6 months to 4 years. While this is a vast improvement over FDA's existing program, we continue to believe that more frequent inspections are needed, particularly of high-risk facilities. Risk-based inspection is a concept that expands across the entire spectrum of food products, not just those regulated by FDA. The registration fee, as proposed, is quite modest. And at $1,000 per facility, it should provide somewhere between $300 and $400 million in new revenue for food safety activities. Let's put this fee into context. In the Peter Pan outbreak, the average cost per victim reporting an illness was $2,650. And this is based on an estimate using the Economic Research Service cost calculator. So when there's an outbreak, consumers who are affected may pay over $2,500 or more. These are individuals. So clearly, a $1,000 fee on each facility to avoid these problems is more than reasonable, especially when compared to the costs of individuals and families that you've had here before this committee testifying on the severe impacts of foodborne illness. In addition, I'd just like to note that companies themselves can run advertising campaigns to promote their products that run into the tens and even hundreds of millions of dollars. To conclude, I just want to say that polling has shown that the public has lost confidence in the safety of food. The percentage of consumers confident in food safety fell to about 22%, according to the University of Minnesota's Food Industry Center. This legislation provides a modern framework for FDA's regulation of the food supply that will deliver many benefits to consumers, though it does stop short of structural reforms that we also think are essential. We appreciate your leadership, and we believe that these new authorities that you're proposing will, over time, prevent the outbreaks and illnesses and help restore consumer confidence. Earlier this year, members of the Energy and Commerce Committee made commitments to the victims of the Peanut Corporation of America outbreak that change would come to FDA. President Obama said, at a bare minimum, we should be able to count on our government keeping our kids safe when they eat peanut butter. We urge you, Chairman, to act swiftly to finalize this legislation and to enact it. Thank you.
Thank you. Dr. Jones.
Mr. Chairman and members of the subcommittee, thank you for the opportunity to be here today. Recent high-profile outbreaks demonstrate the huge challenges and opportunities for improvement in the nation's food supply, food safety infrastructure. Laws, policies, and to be frank, philosophies developed decades ago no longer suffice to successfully meet these new demands. The legislation we're discussing today is therefore a critical step in reviving the food safety capacities of the FDA. I work in a state health department as an epidemiologist responsible for investigating foodborne diseases and, in effect, cleaning up the mess left when things go awry in the food safety chain. I'm excited to see that this proposed legislation addresses many of the problems that I experienced firsthand in my role both investigating and helping prevent foodborne disease. Improving the traceability of food, as called for in this legislation, is fundamental to successfully achieving many of the other tasks described. If traceback information had been more promptly available and shared faster, I think that many of the problems associated with the recent tomato jalapeno incident could have been mitigated. And likewise, tracing peanut butter from one plant to 4,000 different commercial products would have been utterly impossible with many other types of foods. Ensuring that all foods are traceable efficiently and accurately is critical to maintaining food safety. Contamination of produce and foods which are eaten uncooked are of particular concern because consumers have less control over the safety of those foods in their own kitchens. Setting standards for pre-harvest food production starts to close a major current gap in the nation's food safety system. Suspected produce-associated illnesses are particularly difficult to investigate from both the public health and regulatory perspectives. While large food service corporations and their suppliers often have excellent quality control programs with impeccable records, many other companies don't. The portions of this bill requiring country of origin labeling, improved distribution records, and plans to regulate the safe production and harvesting of fruits and vegetables are important to help address these problems. I'm pleased to see that the agency is being encouraged to markedly increase the scrutiny of food handling entities. I'd like to emphasize the importance of basing inspections and product testing and any other interventions by the agency on sound science. The bill does have important directives to improve testing in the science base of the agency's activities. It's critical that from top to bottom, activities are more efficient and effective and not just more frequent. This bill's requirement that the agency's activities are risk-based is particularly critical. It's likely that as technology improves, the value of traditionally defined inspections will change dramatically, and I'd urge that the agency retain sufficient flexibility and authority to adapt to changes rapidly and with as few barriers as possible. I think it's important that in any discussion of the food safety system to emphasize the importance of interaction between FDA and CDC along with state and local partners. In meeting the directive to enhance the science of food safety and develop risk-based approaches, data from CDC and its partners on things like outbreaks, disease surveillance, and attribution of human disease to specific foods will be critical. It's imperative that such data are developed and shared cooperatively to meet the needs of all the partners involved in the system. In every discussion that I've been in pertaining to food safety, the importance and current inadequacy of effective information sharing is probably the most common single topic that's raised. I'm pleased to see that issue addressed in this bill. Improving the technological capacity to share information will be important in accomplishing this. But perhaps even more important is changing the ingrained policies of not sharing information among partner agencies far beyond any logical limit, even when the failure to do so threatens the public health. To meet the mandates of this bill, FDA will have to increase interaction and coordination with state and local agencies, which will require funding and focused attention. Federal regulatory agencies frequently are prohibited from sharing proprietary information obtained during investigations. Flow of information in both directions between FDA and CDC as well as state public health partners is critical. Examples of this include such things as distribution lists during recalls, information on suspected products or producers, and information on potentially exposed people. The FDA, CDC, and other partner agencies must have both the authority and expectation to share actionable information with public health partners to the extent necessary to protect the public's health. And I'll conclude with a final comment about the importance of ensuring FDA and its state and local partners have adequate resources to meet the responsibilities with which they're charged in this bill. No one would argue that the FDA is currently underfunded, overworked, and essentially overwhelmed. State and local food safety capacity must also be robust in order to maintain an effective food safety system. Adequate and consistent funding and resources must be dedicated explicitly to sustain the food safety programs at FDA, as well as the state and local partners who work with them to keep the food supply safe. Americans will eat 1 billion meals today, and I can't think of a better investment than one that will keep every one of those meals safe.
Thank you, Dr. Jones. Mr. Stenzel?
Good afternoon, Chairman Pallone, Ranking Member Deal, and members of the subcommittee. I'm pleased to be with you as you know that the fresh produce industry has been a leading proponent of strong federal government oversight of food safety. My name is Tom Stenzel. I'm President and CEO of the United Fresh Produce Association. Our organization has been privileged to testify 10 times in the last 2 years before this committee or other members of Congress, perhaps only runner-up to Caroline on this panel. Our Board of Directors in January 2007 adopted a series of policy principles calling for mandatory, science-based regulation by the federal government. Today, we congratulate you and the leadership of the full committee in presenting the draft of the Food Safety Enhancement Act of 2009 for consideration. While my written statement contains a number of suggestions for strengthening the bill, I'll focus just now on 3 key areas of concern. Let me start by repeating those policy principles I mentioned. To protect public health and ensure consumer confidence, produce safety standards must allow for a commodity-specific approach based on the best available science, must be consistent and applicable to the identified commodity no matter whether it was grown in the United States or imported, and it must be federally mandated with sufficient federal oversight of compliance in order to be credible to consumers. We're pleased that these principles are recognized in the draft Food Safety Enhancement Act. In looking specifically at the draft, we strongly support the bill's intent in Section 104 for for FDA to focus on maximizing public health by implementing regulatory standards for those specific raw agricultural commodities that it believes are most critical. The FDA has estimated that only 5 commodities have been associated with 80% of all produce-related foodborne disease outbreaks in the past 10 years, and that is where we must direct our resources. In a highly diverse industry that is more aptly described as hundreds of different commodity industries, one size does not fit all. We support Congress specifying that FDA have broad authority to regulate any produce commodities it determines necessary, but with the clear mandate to develop rulemaking that focuses resources for maximum public health benefit on those specific types of commodities for which the Secretary determines that such standards are necessary to minimize the risk of serious adverse health consequences. We also recommend that Section 104 strengthen the support for collaboration between HHS and the U.S. Department of Agriculture and all state agencies in all areas of education, research, and enforcement with regard to produce. It's important that we bring the broadest knowledge and resource base possible to assist all stakeholders in understanding and complying with FDA-set public health standards. Dealing with Section 107 on traceability, I want to assure the committee that the fresh produce industry is committed to farm-to-fork traceability of our products. As I presented in detailed testimony before the House Committee on Appropriations, Chairwoman DeLauro's Ag Subcommittee earlier this year, we have underway a produce traceability initiative to provide electronic traceability for 6 billion cases of fresh produce that move annually within the United States. This is a massive and extremely expensive long-term undertaking, but it's a commitment that we've made. However, we are concerned that the prescriptive nature of Section 107 could actually derail these important efforts to bring the most cost-efficient and cost-effective technology to bear on this challenge. As you weigh various traceability provisions, we urge that Congress set the goal, the mandate for food traceability, but not overly prescriptive requirements such as those in this bill. Rather, we believe Congress would be more effective in mandating an intensive evaluation of technologies, systems, and pilot tests that will truly lead to the end result we all desire. To that point, this legislation should set a goal for total supply chain traceability across the food industry, not single out individual food categories for traceability. Finally, on the question of imports, I believe the committee should carefully examine all of the provisions regulating imported foods to assure equal treatment and fair standards for imported and domestically produced foods. This should be a principle maintained throughout all provisions. In Section 201, we support the bill's intent to require importers to register with FDA and comply with good importer practices. The committee should make clear that this is the standard protocol for importing foods, and that the limitations and restrictions envisioned in Section 109 provide very extreme authorities to be used by FDA only in worst-case scenarios when required to minimize the risk of severe adverse health consequences. With regard to imports, we also strongly support the concept of the Safe and Secure Food Importation Program in Section 113 and urge that the bill require FDA to implement such a program with clear direction that it shall be implemented rather than may be implemented. Finally, let me mention 143 and country of origin labeling. The fresh produce industry is already required under the 2008 Farm Bill to provide mandatory country of origin labeling at retail point of sale. Our industry has moved rapidly to ensure compliance with this law and urges that those products which are already covered be specifically exempted from any new duplicative coverage under the FD&C Act. Let me conclude with a comment about public health. The very Department of Health and Human Services that regulates our safety has the dual responsibility to promote public health, but consider the fact that we need, as Americans, to double our consumption of fruits and vegetables to meet the very simple U.S. dietary guidelines. With that public health imperative, fears of food safety have no place in the Fresh Produce Department. Thank you for your leadership on this effort.
Thank you, and thank all of you.